Raise the table. Very good.
Is it recording, Reagan? I didn't click it.
Yeah, I clicked it.
Is this unilateral, you said?
So now we're going to do the unilateral hip, which means we need to switch this thing out. Thank you, Reagan. And we are going to put this lengthwise. So this will go lengthwise inside here.
The green strip should be facing up on everything, right? All of this.
So green strip was towards the right earlier.
Oh, yeah.
Now it's towards the head. Once again, remember, green strip may also change depending on where you work. So just pay attention to how they do things once you do work at a location. Alright, so we've got our nice 10 by 12 collimation. The centering for the hip is easy. So, okay, no, sorry, I shouldn't say easy. The centering for the hip is consistent. No matter what kind of hip x-ray you are going to do, the centering is always the same. You always center at the neck of the femur for your hip x-rays. So as long as you know how to find the femoral neck, you know what the centering is for your hip x-ray. Does that make sense? Doesn't matter if it's AP, doesn't matter if it's lateral, doesn't matter if it's the Nelius Miller, you always center at the neck of the femur. So how do we find the femoral neck?
Greater trochanter.
3 methods. All right, so relax your leg, keep it nice and straight. All right, so method number 1. Okay, relax both legs, please. Find as is. Okay. Sorry, I think that's the as is right there. So find as is. Find the pubic symphysis right about here. Draw a line between them. Right, so on one end is the as is, on the other end is the pubic symphysis, right? From there, make a T straight down the middle of this line. Once you make your T, you are going to go 2.5 inches along this line. That is going to be your femoral neck. Okay, so that's method number 1. As is to pubic symphysis, make a T, 2.5 inches femoral neck.
You would have to eyeball that though, right? Because you don't want to touch their like pubic symphysis.
Right, you don't want to touch it. So I'm just eyeballing it at the bottom of my hand here. I make a T straight down the middle of my hand, right? And then from here, right, I just measure out myself 2.5 inches, going to be right about here. So that is the femoral neck. Method number 1. All right, method number 2. Find the as is. Okay, so here's my as is. I don't actually want to, oh, okay, good, the light went away. So I have my as is here. Go about 2 inches medial, right here. Go about 4 inches distal, right? So 2 inches, another 2 inches, right here. That's the femoral neck. Same spot, right?
I think that one was easier.
So 2 and then 4.
Just 2 and then 4, right? So as is, you go 2 medial, right here. And you go 2 and 2, 4 distal, femoral neck.
Oh, it is the same spot.
That's why I tried to turn off the light, just to show you that even without it, I would end up at the same place. All right, here's the final method. This is the tech method. You look for the crease here. So what you do is you have the patient bend your leg very slightly, right? You have the crease, okay? Straighten the leg back out.
Yeah, I've seen that.
You've got that crease, right? Right there in the crease. It's kind of close. I was a little bit too far to the side, right? Here's the crease. So it should have been here instead. So that's the problem with the tech method, because the crease goes all the way from here to here, right? So it's like, where do I center on this crease? That's what you need to figure out. So if you want to, you can actually combine methods 2 and 3. You can say, okay, here's the as is. I go 2 inches medial, and then I just come down to the crease. Instead of measuring out your 4 inches, you just come down to the crease. Right, so let's try that out. Sorry, Samantha. Okay, as is, 2 inches medial, and now I just draw a line straight down to the crease right here. Right, right there's the crease of the leg.
Look at you.
Okay, so 3 methods to find the femoral neck. All of them should get you to the same location. Make sense? All right, great. So once we have this on the femoral neck, everything else is going to be pretty straightforward. AP hip, exactly the same as the femur, exactly the same as the pelvis. Just ask them to take this leg and internally rotate about 15 degrees. Right? Make a nice Mortise view of your ankle, and then take your marker, throw it up here in the uppermost corner, and that's your AP hip. Hold your breath, X-ray, you can breathe.
So it's the hip,
This is unilateral hip. Okay with AP hip? Okay. Now, let's talk about the lateral hip. Lateral hip is a little bit weird. For this one, since we already saw modified cleaves for the bilateral, we're going to see something different for this unilateral hip. The methods we are going to see here are called the Lonstein and the Hickey methods. There's Lonstein and there's Hickey. So Lonstein, you're going to take this leg and you want to bring it out at a 90-degree angle. So you're going to have the leg sticking out like this. Okay, so they're going to bend your leg, yep, all the way up like that. So just relax, Samantha. So this leg, so bend up, bend up, bend up, bend up as much as you can, right? Sometimes your patients are not going to be flexible enough to do that, right? Or sometimes your clothes will not permit them to do that, right? But we want to get that leg up as much as possible, out this way 90 degrees as much as possible. Once we do that, we also want to get this femur parallel or flat onto the table. So we're going to have our patient just turn very, very slightly. They need to turn as little as possible, as little as needed to get this femur nice and flat. Right? So for our patient, that's the maximum they can do, right? If they try to turn back any more, the femur is going to lift up.
So you're gonna have your hip up, the effective hip up.
So
like that?
unaffected side will be up like this.
Oh, no.
Right? If you have a sponge or some sandbags or something to put underneath them to help them hold that position, feel free to use it. Okay, but the idea is that we bring this leg up as much as we can, as 90 degrees as possible, and we bring this femur down as flat as possible to get the hip into nice, nice lateral. Okay. Once again, right, there's our crease. So I'm just going to center towards our crease. Okay. I'm just going to slide you back a tiny bit. Samantha, move. Good. And so there's our femoral neck right there. Okay.
Strange.
That's right. And so this is the Lonstein method. Lonstein, leg up, femur flat, opposite hip slightly up, center at the femoral neck.
This is going to be on the spin wheel?
This would be on the spin wheel, yes. Lonstein method. Okay.
Okay.
So lateral hip number 1. Lateral hip number 2, the Hickey method. Start off exactly the same as this. Put them into a Lonstein position, but then throw on a 20-degree angle. So you take this, You angle 20 degrees. And now, instead of aiming here at directly at the femoral neck like earlier, you're going to be just very slightly distal. You're just going to be about 1 inch distal to that femoral neck. Why?
Sorry.
The same reason as the clavicle. Remember the clavicle, I told you when you did the angle, the axial, to aim slightly lower, so that the angle would actually get you through the center of the clavicle. Same thing here. We center slightly lower because of the angle. So when the beam passes through all the soft tissue, by the time it reaches the bone, it will be back in the center. Okay. And of course, I also need to make sure to change my bucket. All right, Hickey method. This is lateral hip Hickey method. All right, so just hold your breath, X-ray, you can breathe. All right, you can relax, Samantha, sorry about that. All right, so those are your 2 lateral hip methods. Once again, you're probably not going to see these in clinic because they're not part of Harris Health's protocol, but you may see them in other locations, other hospitals. Once again, for Harris Health protocol, what do we normally see? We normally just see your AP pelvis and then unilateral frog legs.
Yep.
Okay, great.